South Asia for our next story, and Indian authorities have said that the country has contained a Nipah virus outbreak after confirming 2 cases in the eastern state of West Bengal, as Asian countries have tightened health screenings and airport surveillance for travellers arriving from India. India's health ministry has said that the 2 Nipah cases have been detected since December 2025 and that all identified contacts have been quarantined and tested. The ministry added that the situation is under constant monitoring and all necessary public health measures are in place. Meanwhile, Indonesia has begun running thermal scanners at its major airports, including all the resort islands of Bali, following the Nipah outbreak in India. Now, according to reports, around 5.89 million foreign tourists have visited Bali last year, raising concerns. Joining us now to discuss this is Dr. Sanjeev Bagai, the chairman of the Nephron Clinic, joining us live from New Delhi. Dr. Bagai, thank you very much for joining us here on the programme. First of all, what more can you tell us about the Nipah virus? If it hadn't been contained, was it anything to be seriously concerned about?
Good morning. So Nipah virus is an RNA virus. It's a highly contagious virus. It has an incubation period of approximately 4 to 14 days. But the early, especially from the zoonotic spread of bat urine, the infection can spread within the first 18 hours of contact. So this basically spread through fruit-eating bats, through the secretions of bats, pigs, and other zoonotic animals through the urine or secretions. So it can come from animal to humans and then subsequently from human to human through contact. Although it's not classically as aerosol transmission like COVID was, but it can spread through respiratory airdrops. So we have to be very, very careful. Unfortunately, there is no cure and there is no licensed vaccine. The fatality rate is very high. It's almost 75%, and the treatment really is supportive. Even if you give supportive treatment, the sequelae, especially the neurological sequelae, because the patients normally then end up with encephalitis, meningitis, convulsions, and then ultimately death. If they survive this critical period, the long-term sequelae and damage to the brain and other body organs is pretty heavy. So screening is very important, precautions, public health messaging is extremely important to stay away from these especially the people who work with animals, to be careful with the secretions, to wear protective gear, and in case you have any symptoms, to bring it to the attention of the doctors as quickly as possible.
Yeah, and Dr. Bagai, how much of a job would it have been to get this under control? And of course, the assessment of the need to be concerned about it, is it no longer?
I think we need to be careful, primarily because any viral infection, vis-a-vis like Nipah, presents like any viral fevers. So classically, the people will have fever, headache, myalgia for the first couple of hours or couple of days, and then nausea, vomiting, upper respiratory infections, pneumonias, and then the neurological effects, which is encephalitis, delirium, unconsciousness, convulsions, and then subsequently death. So it's very difficult to differentiate between Nipah virus and any other virus in the first 1 or 2 days. So very high index of suspicion, especially if you're coming from a place where this is kind of endemic or it is spreading, screening and quarantine becomes critical.
Dr. Bagai, thank you very much for taking the time in joining us. It's a pleasure to talk to you. We now move on to our next story and back over to Latin America, and Venezuela's armed forces have officially recognized acting President Delcy Rodriguez as commander